Privacy and security of patient health information are key responsibilities of all healthcare workers. It is important to understand the ethical and legal requirements and to understand how to maintain confidentiality of electronic health information. While interrelated, there are basic differences between ethics and law. Ethics are foundational standards that rarely change. They are subjective and incorporate moral values, but must be evaluated in the context of the issue. A law is an objective rule that may change or be overturned. A law may incorporate aspects of ethical behavior. Just as violation of a law can result in penalty, violation of a professional ethical code of conduct can also result in disciplinary action by the state's licensing board and/or termination by the organization for which the individual works. Confidentiality practices ensure that personal information is kept private. For nurses, that includes actions such as avoiding discussion of patient information in public, keeping one's username and password secure, logging off the computer after each use, disposing of records in a secure manner, avoiding taking pictures of or posting information about patients or your work on social media. A more complete list and discussion of confidentiality practices are found in your textbook and in the Code of Ethics for Nurses document. Legal protection of personal health information was first addressed in the Privacy Act of 1974 and in the federal drug laws of 1970 and 1972. Medicare and Medicaid's conditions of participation required agencies to maintain confidentiality of patient records, but the regulation only applied to participants in the programs. State laws vary with privacy protection, but when the electronic health record was established, new laws were needed to cover the new technology. Title II of the HIPAA Act of 1996 laws protected the privacy and security of health information, but the law covered much more, including other important protections such as continuity of health insurance coverage for employed people, reducing Medicare fraud and abuse. Beginning in 2003, the law was educated and implemented, and in 2005, the security requirements became effective. The criteria for information that must be protected includes information that can be reasonably identify a person. Examples include age, ethnicity, socioeconomic status, date of admission or discharge to a healthcare facility. Protected information includes past, current, or future information about the person's physical or mental health conditions, any care that was provided, and how that care was paid for. All individuals have responsibility to access a health record in a need-to-know basis. That means if you do not have need to have that information to personally provide care, then you have no rights to access the information. A good example is when a friend or family member is admitted to your hospital or even your unit. Unless you are providing direct care, you have no rights to looking at the person's electronic record. If conducting research, a nurse or other healthcare professional can access and use data that has been de-identified. That is, all the personal information has been removed that connects the individual to the data being analyzed. The common organizational policies and practice to comply with HIPAA are found in a table in your textbook. HIPAA laws govern marketing that encourages an individual to purchase a product or service. Fundraising rules related to shared protected health information are also covered under the HIPAA law. Personal health information, or PHI, can be used for research if it meets HIPAA requirements, including review of the research protocol by an institutional review board, or IRB, obtaining an informed consent that is signed in all the appropriate places, and that care under the research protocol is not contingent on signing the authorization for research or informed consent form. The HIPAA laws establish national standards for protection of health information held transferred electronically, protection against integrity of personal health information, protection against inappropriate disclosure of that information, and ensures compliance by employees. The rules established administrative, physical, and technical security safeguards and guidelines for implementation. Administrative safeguards require organizations to conduct risk analysis, to develop a process to maintain and manage security, to conduct periodic workforce training, and periodic evaluations of the effectiveness of their plans. Technical safeguards for electronic health records include controls for access, secure passwords, audits of the integrity and transmission of protected health information. Every organization that utilizes an electronic health record or manages a database with protected health information must comply with the laws of HIPAA. Individuals can be liable for conspiracy and aiding or abetting the disclosure of personal health information. Providers or organizations can be excluded from participation in the Medicare and Medicaid programs for violations of the HIPAA standards. In addition, the American Recovery and Reinvestment Act of 2009 imposed civil monetary penalties if violations are not corrected within 30 days. Fines can reach up to $250,000 and 10-year prison sentences. Complaints can be filed under a voluntary system that has been established under the Patient Safety and Quality Improvement Act of 2005. The Health Information Technology for Economic and Clinical Health, or HITECH Act of 2009, was enacted to stimulate the U.S. economy. The act established the Office of the National Coordinator for Health Information Technology. This organization oversees the development of a national health information technology infrastructure with the following goals: to improve healthcare quality, to reduce cost, to promote public health, to reduce health disparities, to facilitate health research, and to secure patient and health information. The law places business associates and subcontractors under the jurisdiction of the HIPAA law and expands patient rights to include the right to an electronic copy of the personal health information. It requires a risk assessment to be conducted following a breach in the privacy or security of patient health information. The law also gives the state's attorney general the authority to investigate HIPAA violations. Complaints can be filed by anyone who thinks that an organization or individual has violated some aspect of the privacy or security rules. Following the statutes and regulations protecting privacy and confidentiality should be an integral part of every nurse's day. It is important for nurses to understand each organization's particular rules and to adhere to the ethical, legal, and policy expectations of the nurses' code as well as the organization. Examples of an ethical and legal situation are provided in the case studies found in your textbook. A list of internet resources to help you understand the laws and regulations about protected health information is also provided in the text. Attending continuing education workshops, reviewing your organization's policies, and being conscientious in your practice are the best ways that nurses can maintain protection of health information.